there is a problem and stop putting the blame on Black women. I would like to see people stop doing that. Like, it's not her fault. It's not her fault. It's our environment. It's, you know, where we live, what we eat, you know, things that consume our mind and our bodies. And, you know, it's systematic. And so I wish that people would wake up.
My name is Janelle Brockman. I'm 25 years old. I have 3 children, a 1-year-old, a 2-year-old, and an 8-year-old. I had my first baby. She's a girl. Her name's Alea. I got pregnant at 16 and had her at 17. So my experience is also as a teen mom as well as a Black mom. I was feeling pain, and they hadn't checked me since they found out the gender, and I was full term. And he said I would have to go past my due date. And he also told me there was no room at the hospital. And so I'm like, okay, well, what happens if I go into labor? He's like, they'll just have to figure it out or put you in one of the extra rooms. I'm like, okay, you know, as long as they get me in a room, like, I'm not picky. And it was a check. I didn't know that you could decline these checks or anything like that. He was very, very aggressive. If you check too hard, you can strip someone's membranes. And being a doctor, they would most definitely know that. Like, there's no way it's an accident. They would know that. And he made me go into labor. I was feeling immense pain afterwards. I went all the way up until, that was an afternoon, like around 12. And I went all the way up until like 5 a.m. the next day. And I was in labor that whole time, apparently, and I had no idea. It was so painful. And when I got to the hospital, they said the baby was like dilated. He was like right there. My water broke. And that they would be able to deliver him breech because he was upside down. And I asked him to check that, and he refused. Like, they didn't want to do an ultrasound. They hadn't done one since I found the gender. So he refused. He said there was no need. So when I got to the hospital, of course, he was upside down. I just panicked, and I just immediately told them a C-section because I had heard about women experiencing more tearing and bleeding, delivering breech. So I felt my only option was to get a C-section. They weren't very communicative with me after that. They told me that my boyfriend, my child's father, was allowed to come in the back with me. They were getting a hairnet on him and everything. And I was back there, I'm waiting. They're putting me to sleep. And I'm not going to sleep right away for some reason. And they all of a sudden told me he wasn't allowed to come back. They didn't tell me why or anything. My boyfriend didn't get to see his son being born or anything. And I woke up, and the doctor came in, and he was like, I'm so sorry. And I was so angry with him. I didn't want to say anything to upset him because I have to see him the duration of my time at the hospital. So I just kind of brushed it off like it was no big deal.
It's very difficult being on both sides of the fence, like being a patient and also being an advocate, because I know that sometimes people are not able to advocate for themselves. They have it in them, but they have just been silenced for so long that they don't even realize that they can advocate for themselves. And that piece is very hurtful.
Most research does not include us. And so we don't really get to have the benefit of, longitudinal studies and research that tells us the why. So we have to live the experience, right? And have the outcome.
I have a 4-year-old daughter, and I have a 1-year-old son. And from the moment I was pregnant with her, I knew I wanted to have my baby at home because I did a lot of research, and I learned that Black women are 2 to 3 times more likely to die during childbirth. And that's something that I didn't want to experience. So I started doing a lot of research into midwives and home births.
It does not matter your education level, your socioeconomic background, where you live, and also what insurance you have. We are still at risk when we have private insurance and managed care plans. And the one thing that we all have in common is that we are Black women.
I hear a lot about women's pain not being taken seriously, especially women of color. I guess they seem to think that like women of color have a higher pain tolerance, and I don't know why that is, because I definitely don't.
I got pregnant with my daughter Jordan at 19, and then I found out I was pregnant with my son at 20. The doctor, when he came in, he was so inappropriate in so many ways. When he took out the placenta, he asked if I was one of those hippie people who wants to encapsulate or like eat the placenta, and was like, "Are you gonna eat this?" And I was like, "No." And he was like, "I didn't know if you were one of those, hippie weed smoking ladies that do." And I'm, obviously, I kind of took super offense to that, because I doubt he would say that to any other person. But considering how their dad was dressed, and considering our skin color and my age and our age difference, it was very offensive. And he didn't really care for my well-being at all. Like when the anesthesiologist came to put in my epidural, I told her it wasn't working, because at first it was only working on my left side. And I felt everything on my right side, which was just horrible, because you can't move your left side, but you're also having this extreme pain in your right side. So I told her it wasn't working. She took it out, put it back in, shifted it, and when I told her that it hurt, she said to get over it, it's gonna hurt. And I told her that I have scoliosis. And then everybody went into panic, because she could have paralyzed me the way that my spine is curved. And I expected her to know that, because it's in my chart. It was the first thing I told the nurses, despite being in pain, was when I have this epidural, I have scoliosis. It leans to the right. She shifted it to the left. And they told me later that if she had shifted it 2 centimeters too far, I would have been paralyzed as a 19-year-old mom.
So they did an ultrasound, and they discovered that my placenta was starting to abrupt. So I was in the hospital by myself because of COVID. And there was a doctor who kept trying to force me into getting an induction. And I was communicating with my midwife the entire time, and my midwife was telling me everything to say. So I was advocating for myself, but with the help of my midwife, I kept telling the doctor that I'm in communication with my midwife, and we're not gonna do an induction yet, because my son, I was 37 weeks at the time, but he was measuring small. And so my midwife thought that it would be best for them to just see if they could monitor me up until my due date, and just keep track of his heart rate, just to make sure he's still moving, doing my kick counts, just so he could have more time to grow, because he was measuring so small. And the doctor was being very rude. They kept trying to scare me, saying that my baby would die if I don't get an induction. My midwife asked me to see if I could get it documented. The doctor refused to document anything that she was saying. I didn't like that experience, because they were very rude and nasty to me about it, and just telling me that I would lose my baby because I wasn't getting an induction that day. That was not a great experience for me.
It's race as a construct. We did research with 115 women across all disciplines, economic, educational, marital status, and where they lived. And what was interesting is, regardless of those factors, their perceptions about their health were the same. Their perceptions about their experiences and going into a doctor's office and having to think about how much they push on asking questions because they don't want to be seen as an angry Black woman.
With John, it was a little smoother, because I had a new doctor and she already knew my situation, and she was very unbiased about everything. So it went a lot smoother, but you still face like the backlash of being 20 with a 1-year-old.
I would like for the world to stop and listen and to realize that just because you are not a Black woman, that it doesn't affect you. It affects all of us when it affects our community. And, you know, they've declared racism as a public health crisis because it is. And a lot of people like to ignore that racism exists, or they think it's a coincidence that so many Black women have this same story every time about going to a hospital and having a child and being terrified that they won't make it or that their baby won't make it. It's to the point where a lot of people have opted out for hospital births and are having babies at home, and which, you know, historically has happened for us all the time, and we were fine. But you know, there are a lot of women at that crossroad where they just do not trust healthcare professionals, and that's just not with having a baby. We're talking the whole, you know, circle of care.
I just couldn't like get my words out for some reason, and someone holds a scalpel over my stomach and asks another doctor should they begin cutting, and I wasn't asleep yet. I wasn't given any pain meds or anything, so I'm like freaking out trying to talk, but I can't get the words out or anything.
My son had to get put on a CPAP machine because I guess they gave me a high dose of the anesthesia, so he came out like high, I guess. They had to put him on a CPAP machine. He swallowed some blood from me.
We hold a lot of space and we stand on the shoulders of giants and we keep it going, and so we have to make sure that the Black woman is well, because without that, then, you know, a lot of things come to a halt, and we deserve that. It's our birthright to have a healthy pregnancy. You know, having a baby shouldn't be a death sentence.
I don't know what caused my placenta to erupt, because I don't do drugs, I don't drink, I didn't get into any accidents. You know, I wasn't doing anything that would put a lot of strain on my body. So I spent a lot of time blaming myself.
You just have to know your rights when you go into the hospital and stuff like that, because even if they're not, you know, directly doing anything wrong to you, they will, you know, push you in their direction, and everyone's birth plan might be different. What everyone wants might be different, so you have to voice that. Unfortunately, they're not going to ask you that, so you have to know that stuff on your own.
I'm still going through the grieving process of it, because I didn't really get a chance to process having that experience, because I just focused so much on taking care of my kids. I didn't really get sorry, I didn't get to really process having an emergency C-section.
If you find out that you're pregnant, I think the first thing you should do is, you know, find out what hospital you're delivering at and the doctors you're going to be working with. Find out if they have good reviews. I found out in my research, look at their reviews specifically towards white women, and if they're not treating white women very well, they're definitely not going to treat Black women very well.
Our birth experience can be so much more with the more resources and the more support and the more access to quality care that we have.
And other people's opinions don't matter.
And if you want somebody to go to the doctor with you, you know, you can find we call them sister bays at Queens Village. Find you somebody who can go and take notes while, you know, the doctor is there talking to you, or even if you have to call a friend on the phone to record, you know, the doctor, or, you know, whatever it is that will make you feel safe. I highly encourage all Black women to do that. And, you know, we have to advocate for each other. We have to be there for each other, and be comfortable and be brave to speak up too in times where you feel silent.
I try my best to find the resources and, you know, just educate them as much as possible, because, you know, that's what a lot of us do need. And I feel like, you know, if we work together as a community and continue to educate our Black moms.
When we're all together, we're at all different aspects of life, and that we really have the ability to uplift and change our circumstances when we work together.
My name is Janae.
My name is Mona.
My name is Neva.
My name is Janelle.
My name is Daniel.
Can you hear us now?